Everyone. This morning, you're going to be hearing from your unified command that has been hard at work over this time period since we began this work as a emergency operations center. So after I get done sharing some information with you, both Dr. Elliott and Dr. Wilde from Avera and Sanford will be sharing some information with you as well. So a few things I want to cover this morning are that on Tuesday, this last Tuesday, we had a first reading of an ordinance that would repeal Ordinance 4720, or what we are calling our no mingling ordinance. That ordinance was first passed on 5/7. The no mingling ordinance was part of a measured approach to loosen some of the mitigation efforts established to slow the spread of the virus that causes COVID-19. So the second reading of this ordinance is on Tuesday, the 26th, so next Tuesday. And between now and then, we'll continue to review, reassess, and realign as needed before that time comes. We'll continue to monitor the data, knowing that if we see any change in our trajectory, I don't anticipate we will, but this virus is doing unexpected things, and so we continue to closely monitor that data, and we'll advise the council as needed on Tuesday. We'll continue to have an updated data model forecasting the need for hospital beds, and we will meet with the Board of Health that afternoon, earlier before the council meeting, to provide an update to them. And then we are working on a resolution that can provide some guidance to this community as we if the council does repeal the no mingling ordinance, and can allow us to have a common set of guidance that we will be moving forward with as a community. And so they'll regard that afternoon, and then that will come forward to the City Council. So we talk a lot about the data and the information, and we always promise you that we're going to be making sure that you're staying updated on that. And so some of the things that that have driven the decision making all along, and will continue to do so, is a couple of data sets that I want to show you. These are going to become a daily dashboard for us that we'll be working off of and making sure we're communicating effectively to everyone. This is that 14-day trend and seeing a reduction in new cases. And so you can see we're seeing a downward trajectory over 14 days. We'll continue to monitor this every single day and update this particular dashboard. But this is one of the major pieces of data that is really driving some of our decision making right now, is the fact that we continue to see this downward trajectory. When we had this increase here, that was some of the community testing that was being completed, but we are slowly and very consistently seeing a decrease beyond that time period. And we're going to see increased cases. Every time we decide to do more testing, of course we're going to see more cases. And so this can't be the only thing that we're monitoring and working off of. We also have to be looking at our hospitalization rates and our cases, because this is really the measurement that has been driving our policy before the City Council. We've always, been very clear that that was some of the reason we had to put in the policies that we have, and that we've been working so hard to make sure we're explaining to the community what they need to do to help us mitigate the spread so that we don't overwhelm our hospital systems. So you can see here where we have been way below what we were modeling that we would be at this time period, or close, around this time period. We were predicting that by now we would be seeing a surge that would be taking us far higher than what we've been experiencing. All of that is really good news, and does give us some sense of comfort that we can continue to loosen our approach in this community. Now, with that said, that doesn't mean that we can let our foot off the accelerator of mitigation efforts. We have to continue to be monitoring. We have to continue to be nimble as a community to be able to change course as we need to. And we need to continue to be following the mitigation efforts that we have put in place that are just standard and kind of that baseline for our community. So we did what we needed to do right now. This community has been exceptional in being able to not only flatten the curve, but really dampen the need for hospitalizations in our community. But we need to continue to practice our physical distancing. We need to continue to make decisions that are in the best interests of our community individually as to how we are going to interact with others during this time period. And we need to make sure that we practice that good hand washing and good hygiene for the foreseeable future. So, we'll continue to make decisions as we need to. Tuesday will be a big day to make another set of decisions. But we are going to continue, as a public health matter, continue to be monitoring this. We're going to continue to be making decisions that are in the best interest of the public health for our community. So the EOC continues to operate, continues to be doing all the things that we need to be protecting this community. So with that, I'm going to turn it over to Dr. Elliott from Avera, and he has some remarks, and then Dr. Wilde will follow. Thank you.
Good morning, everyone. I'm Mike Elliott. I'm the Chief Medical Officer at Avera McKinnon Hospital. I echo all of Jill's comments. Honestly, I stand before you today humbled and grateful for the effort of all of the folks in our region, the efforts towards flattening this COVID curve. Our lives have been altered dramatically. Work, family, planned vacations, graduations, weddings, funerals, everything that's been put on hold for all of this. Another thing that's been put on hold and is of concern is people accessing maintenance or preventative health care. And that's a grave concern to us. We've said all along this is fluid and things are going to change. And as Jill pointed out, the data is certainly significantly different than where we thought it was going to be, and that's a good thing. But given the data and the trends, I need you to know that Avera as a system is reopening, ramping up our ability to schedule in-person clinic visits, our planned surgery capabilities, our abilities to do imaging, screening exams like mammographies, or procedures like colonoscopies, physical screenings. Plans to restart these services were not made lightly. A lot of thought has gone into, can we start to transition away from surge planning and transitioning to what it's going to look like to live with COVID? And just because we're reopening some of these, I guess you could consider them routine services, this does not mean that we are done with COVID. We are still in the throes of it. It is still a risk in this community. As Jill said, it is still so important that people wash their hands, wear their masks, practice social distancing, and if you're symptomatic, by all means isolate. We do not want to see this illness spread. When you come to our hospitals or our clinics, you will see these mitigation strategies and many more in place. Stickers on the floor to signal how far apart people should stand. Tape over chairs or chairs removed so people sit 6 feet apart. Plexiglass to separate you from people at the front desk. Again, all of this is done. Our hospitals, the city all along has emphasized that the health and safety of the people of our region are our top priority. And so all of these mitigation strategies that you will see when you come into our facilities is simply that. It's us living up to our word to guarantee that our patients and our staff remain safe in our buildings. So if you've put off any needed health care, any maintenance or preventative health care, if your children need routine immunizations, if you have screening exams that you should be getting done, please call your physician's clinic, schedule these things. Again, our health and safety has been a top priority. It remains that, and we can't forget the other aspects of healthcare that go along with maintaining health. So with that, thank you, and I'll turn it over to my colleague, Mike Wilde.
Thanks, Dr. Elliott, and thanks, Director Franken. Dr. Mike Wilde, Vice President Medical Officer, Sanford, Sioux Falls. I would start off, number one, whenever you go second, you always agree with my colleague from Avera, because as we've shown over and over again how unified we are as healthcare providers along with city, state, federal government. That has been a very powerful, and hopefully it's been very transparent to the public as well, that the interest in everyone's well-being. To that point, a huge thank you to the city leadership, including the mayor, Director Franken, the city council, the health board, as well as the folks, as the mayor has alluded to several times, the folks behind this wall, really making day-to-day hard decisions, and in my opinion, have done a really wonderful job. And it's always been about not exceeding hospital capacity, which in turn is patient autonomy. Can you make your own choices in healthcare? We have seen tragic examples of this throughout the world and the nation, and we took steps to not be there. And with the help of the community, as we're all in this together, the community has stepped up, and it's been very humbling to see the response that has occurred within the community. To that point, they're not knowing how long things were gonna go on, as Dr. Elliott alluded to as well, some care had been paused, very appropriately so in the moment, but very appropriately so now opening up again as well, because it's necessary care. I would point out the message, and I agree completely. You don't necessarily need to stay at home, but you do have the ability to make your own choices. And if staying at home for you right now is in your best interest, do so, because there are people with compelling indications to do that. For the most part, things are opening up, and that's a good thing. Take advantage of them, but be safe, be smart, because you've shown that you are. And you know, I've learned through this as well, the enhanced need for distancing, for hygiene, and some of the practices that occur as we sit here with masks on and everything else. As I've seen in the community, there's been a tremendous response from that standpoint. If you're ill, stay home. If you're ill and need care, call. So we can appropriately triage to the right location for your safety, for staff safety as well. We did stop elective procedures now about 2 months ago. We did not stop clinic visits or anything of that nature. However, patients really stopped coming in, as I alluded to already, and that's fine. Choices were made. However, what we're now seeing is some ramifications of that, and we're seeing a need for in-person care. There will always be the ability for video visits and telehealth visits, but we're really seeing a need now to get back to some of the routine care. And routine care are things like necessary surgeries in the setting where people are really suffering, screening examinations like Dr. Elliott alluded to, vaccinations, well-child visits, things like that. Those are very imperative things that can really prevent other surges due to other maladies going forward. At Sanford, we have started this within the last couple of weeks, and the public has responded and really sought the care. We've seen a tremendous increase in visits and interest, and we certainly would encourage that for everyone's well-being. When you do visit Sanford, you will see that we do require staff to be screened, as well as visitors and patients. We also require masking. And it's for everyone's safety as they come in. As of yesterday, we are allowing one visitor per, whether it's a clinic or an inpatient visit. And there's a process to go through, and you'd be educated on that, but it's really pretty easy to do. The best way to do that is if you do need a visitor to accompany you, or you wish to have a visitor accompany you, they can make that clear at the various entry points to Sanford and go through that process real quick and be allowed to visit. With that, I would just simply conclude that, again, a sincere thank you for the community response, for where we're at today, for the city leadership as well. And with that, I turn it back over to Director Franken.
Great. I really want to thank these two gentlemen. They have been really in this a fight along with us in the Emergency Operations Center as part of Unified Command. We're going to continue to discuss where we're at as a community on a weekly basis. We're going to continue to stay engaged with each other and make sure that as we need to scale appropriately our response, that we're ready to work together to make those decisions on how we need to accomplish that. But I do thank them for their efforts. I have to just thank the community as well for where we're at today. We have done this together as one Sioux Falls, and I think that we have made tremendous strides. That's the work we have to continue to do. We have to continue to work together. We have to work to be respectful of each other. We have to work to mitigate the spread by doing the things that we need to follow the guidance that's out there on how we handle our hygiene, how we wear masks in public as much as we possibly can, how we do those things that can help be part of this community together. As we start working out how do we socialize a little bit more distantly, how do we engage with each other in a new way so that we can continue to fight this battle against this virus and the pandemic. So with that, we'll take any questions you have.
Yeah, do your hospitalization numbers include out-of-state patients, and if so, do you know how many?
Those hospitalization numbers would be any patients that are hospitalized with COVID in either of our facilities, so it is possible that there could be some patients that are not from Minnehaha and Lincoln County area, for sure. Mm-hmm.
Any idea how many?
I do not know that.
I have a question for Dr. Elliott or Dr. Wilkie. Question is, how many of those patients that have COVID are in the hospital or in critical care?
The percentages varied a little bit. I would say in general, roughly a third of the patients at Avera McKinnon that are positive for COVID are in the ICU. At times it's probably down to a quarter, maybe even a little bit less than that, but for the most part, I'd say we're pretty close to about a third of our hospitalized patients with COVID are in the ICU.
And how long do those patients typically stay in the ICU for? Or how long does their stay?
You know, that's a little bit of a hard, I can give you a flat answer. Our average COVID positive ICU length of stay is roughly 5.4 days. But that in no way, shape, or form gives you the whole picture. I mean, we have had patients that have been positive for COVID that are going on 3-4 weeks in the ICU, and then others that are there for a much shorter period of time, obviously. So it's a wide range is maybe the best answer to that.
And that's for all age ranges too?
That is correct, yes.
Awesome, thank you.
Yep.
Have you seen any different trends?
So the question is, has Sanford seen any different trends compared to the answer Dr. Elliott gave? I would say the quick answer would be we've been really similar. I think it's important to point out, thank goodness, and again, thanks to the community efforts, the region efforts, we have not seen a large number of patients, therefore the data is highly variable like Dr. Elliott alluded to.
And any idea on the average age of these patients that are going there? Or a specific demographic that is especially?
So the question is any demographic and or age that we're seeing. And I would say it's, my age, kind of that middle age and older type population. And certainly, as we have seen nationally, internationally, chronic medical conditions, things like diabetes, chronic lung disease, things of that nature.